during the consultation, you mentioned that you came here originally for the low back pain, upper back, but mainly the thing that's bothering you the most is the knees and feet. Is that right? So let's start off. What's the most troubling for you? Are you talking about your feet, the knees, low back, upper back? Which one's bothering you the most?
Everything, but I think my feet is
the feet the most. Okay, show it to me. What's going on with the feet?
This part hurts. This part.
Okay, so basically the calcaneus, the heel on the inside, and also the balls of your feet, that hurts the most, okay? And what about the left foot?
The same thing.
Same thing?
Same thing, please.
Alright. What about the Achilles? You also have an Achilles as well?
Yeah.
Okay.
Well, it's like, I feel like around here. I don't really know what's, but like this.
Where do you mostly feel the pain? Do you feel it most on the big toe, the middle toes, or the pinky toes?
Not in the toes, like at the bottom part.
Well, I mean, like what area of the foot? Are we talking closer to this side, in the middle, or on the outside of the foot?
I think closer to this side. Like this side.
Okay, so the reason why I mentioned about that is because we have several nerves in the feet. This area over here, mostly for the big toes, mostly that fourth lumbar nerve innervation, sometimes fifth, but it's mostly four. You also have the sacral nerves. The plantar nerves come down, from sciatic nerve, converts to the plantar nerves, and it does branches out, like over here on the bottom of the foot. So it could be the medial branch of the plantar nerve. We also need to investigate that one. So we'll take a closer look on your spine. So see which one we need to address. Do we need to address more the fourth or fifth lumbar nerves, or maybe the sacral nerves? So we'll find out. Next thing is the knees. What's going on with the knees itself?
It hurts like this part.
So where does it hurt most?
It hurts like inside, but when it hurts, if I touch it and I go like this, I release the...
So massaging here helps.
Yeah.
But on the outside?
Well, I just go like that. I don't know what's...
Got it.
Just
and what about this?
Do the same
thing.
I'll do the same thing when I release, the pain.
Gotcha, because I do see quite a bit of swelling over here, and not so much here, but this is more swollen.
Yeah, this is sometimes worse than this one, but yeah, both of them are.
Actually, this is also swollen here too. Okay, we'll investigate that one too. And what's going on with your low back pain?
I feel pain all the time, like this part.
Can you show me? It's hard for me to see. Can you stand up for me, please?
Yeah.
Stand up for me.
Like this part, when I see it, or when I stand up, like a lot of times.
Let's put you a little more lighting. So you say when you sit for a long time,
yeah, this part, lower.
Okay. Well, see, this is another thing I'm seeing over here already. Right off the bat, you have there's like this band of swelling over here. So your body trying to protect something here. So we'll investigate that. There's also a lot of swelling here too. So you feel the pain on both sides of this joint over here?
Yeah, both sides.
Got it. And what's going on with the upper back?
Also, right, like this part.
Shoulders.
When I sometimes move my hand up, feel pain right here, or the other side too.
Okay, so we're going to take a look. Any potential levels? See what your body says. See, you got something going on already. Here. Scanning down. Okay, we got a reading here. Small one there. It's not too bad. Small little reading out to the left. So now we're scanning with visualization as we did earlier. We saw this big band over here. But looking over here, I also see this swelling over here as well. So the body's trying to protect something, and there's this pitting edema right at the spot over here. Okay. See, we got this pulling right over here on that sacral segment over there. So now let's just go ahead, let's investigate, see what's going on over here. Pain right here? Not too bad? What about here? Right there, huh? Yeah. So check a look at that. How's that? Pain? Yeah, see, that's not moving too well. See. Okay, so we're gonna have 2 less. That's one candidate. Oh, this is not too bad. How's this? Okay. Not too bad? No. So even though there's a reading at that 4th lumbar level over there, once we adjust this one, it would not surprise me if this fellow over here starts stabilizing and then disappear. Well, what about this one over here? Oh, yeah. Yeah. Oh, no. Okay, go ahead, relax a little bit. Not too bad, okay. Now, I understand your vision here for the feet problem and the knee problem. And so why are we looking at the rest of the spine? Is because, well, here's the thing. If there's a problem at this region of the nerves over here, those nerves, they go straight down from here, down to your knees and into your feet. So if you have any traffic jams over here, how can we expect the information from the brain go all straight down to your feet? It's going to have a tough time doing so. That's why it's very important to take a look, see what's going on over there, reduce that traffic jam, clear the obstruction, get some more nerve power straight down to the knees and the feet itself. Now, we touched base on the neurology and the examination, we confirmed on you, okay, so we got a second sacral segment involvement that's leading all those straight down into your knees and feet, okay? And in addition to, you also have some irritability on that 4th lumbar nerve that explains why you feel that pain right on the ball of your feet on the inside of your foot, okay? And then for your shoulder, what's causing that to jam up, and that's what I see on the 6th dorsal over there. We'll address that one as well, because it's not going to prevent the ribs, and basically it's causing that rib to misalign a little bit, slightly, and not allowing your scapula, that shoulder blade, to glide properly. So that's what you notice, and that's what you discuss with us. It says, I'm doing this shoulder thing. It's like, oh, I can't do that too well. So therefore, every time you do that motion, just like what you see over here, okay, this shoulder blade over here, it needs to glide over all these ribs on your rib cage. So if there's any particular misalignments over here, okay, and that's what we're seeing over here, I want to see these ribs to be symmetrical. And yet, these are not symmetrical. These are a little elevated up. So therefore, that explains why it says if these are, the ribs are a little elevated, just like over here, the shoulder blade got to go over here. But if it's like this, it now acts like a speed bump. So like, okay. So the shoulder blade can't glide as well as it should. That's where you know it says, huh, so what's going on with that fellow over there? It can't do it too well. And when you start to feel pain on the lower part of that. So that's one aspect. So we're going to address that. I want to see your bones try to get more leveled. Okay. Your talus bone, okay, that's a keystone of an arch, because your foot's like this. It has to be an arch like this, and this bone over here is what's keeping the whole entire arch intact. But if this bone over there, the keystone collapses, the whole entire foot collapses like this. Right? So that's what I'm seeing over here. Normal for this talus bone over here, I want to see it more like this way. But instead, it tilted upward this way. So that's a strong suspect I want to take a closer look at, okay, during examination. In addition to it, that's why you have a little arthritis on the back over here. So that tells me, no, this isn't recent. It's been there for a long time. All right. And same story as well. I'm taking a look at your metatarsal arches over here, especially that one. That's also misaligned. We need to address that one for your right foot. For the left foot, it's also a similar story as well. The talus is misaligned. The metatarsal is also misaligned. The cuboid is also misaligned over here, and it's swollen over here. And same thing with your 5th metatarsal, it's also dropped a little bit more. So we're also going to investigate, see what's going on in that one. In terms of your knees, okay, I do see that this is a little more gapped open over here, and also a big widespread over here. So it wouldn't surprise me when we investigate this. This may be a PEX tibia, so we'll investigate that one. But it's also, I see there's some swelling over here as well, so it may aggravate that one. So we'll check the medial meniscus on that one. This one is much more swollen compared to the left. And I also see the misalignment gap is also more on this side. So therefore, and also this thing's rotated. So I'm going to confirm that on you. You may have an AIN femur on this one. A little more down. Excellent. Excellent. Okay, stay right there. Now we're going to check the ribs. See, this rib head is still out a bit. Set this real quick. There it is. Okay. Let it go. Excellent. And you also pop this rib out too. Okay, we're going to set this one right there. Let it go. There it is. Come on up.
So much better, yeah.
Sorry, say again?
So much better.
So much better, huh? Yeah. Nice. First things first, let's check this one. Yeah, relax, relax. See, this is stable. This is loose. Okay, so that confirms the radius. You got a femur involvement. Swollen right there, huh? Tender. Right here. See, you've got the medial meniscus. So we're gonna pump that a little bit. See, it's loose on the outside. See, it's stable on the inside. Yeah, see, you do have a PX tib. PX misalignment. This is an AIN femur. So first things first, we're gonna go ahead, we're gonna pump this meniscus back in place for AIN femur. So now we're gonna pump this back in place before we set your knee. Let it go. There's that fella. So here's the other component, okay? So we confirmed that's a PX misalignment, but tender right here? Yep. So this is swollen, this joint capsule over here, and you got a Baker cyst over here. So we're gonna pump this one in place before we can set your knee. There you go. It just went in. Now we're gonna set this poor fella. Let it go. There's that fella. Okay, walk around. Okay, so how's the knees?
Drowning better, yeah.
Nice, right?
Yeah.
As we touched base earlier, we saw the X-rays. You got those talus issues. So now we're checking it. See, we can't dorsiflex them too well. And so we have an AS medial talus on both of them. So first things first, we pump it up before we set it. A little more. There's that fella. A little more, and I got most of it. I gotta get this angle. There's that clunker. Okay. Tender right there, huh?
Yeah.
Yeah. So we're gonna set this. First metatarsal. There's that biggie. Right here as well. There's that fella. Okay, walk around. See how I like them. No, you gotta walk a little more. I'm sorry, say again?
It's better, yeah.
What's better about it?
The pain, it's released, yeah.
Nice. Any other difference you notice in your feet? How's the springiness? How's that?
What, this?
Yeah. How's the feet when you're walking?
Yeah, it's better. So it is better.
Yeah. Does it feel like you're like bouncing around in that?
Yeah.
All right. Okay. Anything else, my friend?
That's it, I think.
All right, man. Okay, it's been a pleasure. I'll see you next time.
All right.